Hey guys, Dr. Steve here at DiMartino Chiropractic. Today we're going to talk about hip pain and knee pain, and specifically more hip pain, okay, and what we see here in the office. So many causes for hip pain, and in layman's terms, when patients come in there and say they're having hip pain, we get a lot of different areas, okay? We'll get the outer thigh, the glute area, above the lower back, different areas there. When we talk about hip pain, we're specifically talking about actually in the hip joint, okay? And that can refer pain, like I said, to the outer thigh, the glutes, a little into the lower back, as well even into the groin area and the inner thigh as well, okay? So many different areas that it can create some pain in, okay? And we'll get different things such as dull, achy pain, that deep socket pain inside where the actual hip joint meets, okay? We'll get limping, uncomfortable sleep positions, basically any activities throughout the day, whether you're walking, any weight-bearing activities, lifting, bending, and basically just from standing to sitting or sitting to standing can all cause pain in the hip, okay? There's certain other childhood diseases that will predispose people to hip pain as well. We can have inflammation of these joints, we can have inflammation tendonitis, we can have certain muscle tendon strains, we can have ligament sprains, obesity plays a role in hip joint dysfunction. So all these things, traumatic events can also play a role in these hip pain and symptoms, okay? So what I want to specifically talk about is what we see in the office, and that is a dysfunction in the hip or the pelvis, okay? So when patients come in, and they give us their symptoms. We look at the spine, obviously, but we also look at the pelvis as well, okay? And what we notice a lot is we have a leg length discrepancy, so an unequal leg length, okay? So the hips are rotated, one is higher, and creating a leg shorter, okay? So over time, throughout these daily activities, your body has to compensate for these things, okay? So that can stem all the way, from as low as your ankles all the way up throughout the spine, okay? So when we have an imbalance in the pelvis here, your lower back compensates as well. Certain ligaments and muscles will tend to shift, get irritated, inflamed, and can cause all types of pain in the hip and those surrounding areas, okay? So our job as chiropractors is to check out the pelvis, the lower back, as well as everything else, and just to make sure there's not dysfunction and that these segments in the lower back as well as the pelvis are moving properly, we have proper range of motion, and if there isn't, we properly restore that motion and get this body back to healing, back to proper function. All right, guys, so if you're dealing with any of these issues, get in, get it checked out, and hopefully we can fix this. All right, guys, have a good day.